Most of us have heard about pregnancy complications, but what we have not been told, what too many women leave the hospital not knowing, is that those complications may be their hearts sending a message that could take years to fully show up. And by then it may be too late. I had the opportunity to hear Dr. Williams speak at a heart health luncheon, and she said something that totally blew me away, that women who have had preeclampsia during their pregnancy may be at risk for heart disease 10 years after they give birth. I'm like, what? I had to meet her, and I was like, I never knew this. What the heck? Right? So that's the reason why she's sitting on this panel, because I told her then, I was like, we're gonna have this block party for Black Maternal Health Week, and I need to get your information because you need to tell everybody that. Everybody that. So Dr. Dominique Williams is a board-certified cardiologist who specializes in women's heart disease and improving maternal outcomes. She works at Ochsner Health. Clap it up for Dr. Dominique Williams.
Thank you.
Yes. And this person sitting to my right is Dr. Alicia Reed. She's a pharmacist, community health educator, and founder of Your Self-Care Prescription LLC. She brings clinical expertise and lived experience to the conversation. Super important. So clap it up for Dr. Reed. Okay, so we're gonna get started. This is a question for both of you. What is one thing about women's heart health after pregnancy that should be common knowledge but isn't?
I think I'll start. Just listening to you, reiterate what Dr. Williams said about the 10 years.
Yeah.
My son is 10. And I have high blood pressure. I had high blood pressure throughout my pregnancy. And that was something that wasn't communicated to me. It was just like, let's manage your blood pressure while you're pregnant. Okay, you delivered. It's fine now. Okay, bye. You can go follow up with your primary care provider. It wasn't, the message wasn't, okay, since you've had high blood pressure during your pregnancy, this is something that we need to watch because 10 years later, you may have a risk, increased risk.
Yeah.
Yeah, so absolutely. So one of the things that I like to tell my patients and think women should know is that when it comes to pregnancy, it's not just growing a baby, it's also a total change and total stress on the body, including the heart. And how you respond during pregnancy, you're essentially having a stress test. And so if there is something that goes wrong, that should be a signal, something is wrong with my heart. Not just your heart, but if your blood sugar goes up, hey, maybe I'm going to be at increased risk for diabetes. And so it's really important to be in tune to what happens to your body during pregnancy, because we do know that what happens during pregnancy can foreshadow what's going to happen in the future.
Yeah. I'm still blown away 10 years later. My son is 23, and I didn't have any of these issues. However, I know plenty of women who did. So now I'm like, okay, how old is your baby? Your baby's 3. Okay, now you pay attention, watch for this. I'm still floored about that. So I was like, we have to talk about that. Dr. Williams, this question is for you. When a woman has preeclampsia or high blood pressure during pregnancy, what is that telling you about her heart long term? You started to talk a little bit about that, but let's really dig into that.
Yeah, absolutely. So preeclampsia is known as high blood pressure during pregnancy, but it's more than just high blood pressure. It is evidence of what we call end organ damage, meaning that the blood vessels are not functioning properly. There is stress on the organs. And so if we were to look at your vessels, even your placenta under a microscope, we would see that it's abnormal, okay? And we also know that when we look at women, even months after delivery, even a year after delivery, and we look at their heart still has some changes that we would not see in a woman who did not have preeclampsia. And so it's more than just high blood pressure. There's also the misconception that if I have preeclampsia, I have to be pregnant. That's not true, okay? And the reason I say that is because you can have a baby, go home, and present 1 week later with preeclampsia, even though you're not pregnant. Okay, so we know that there is something going on in the body that causes it to respond abnormally. Something in the vessels, something in the vasculature, a response that women have. And unfortunately, Black women are some of the women that are at highest risk for preeclampsia. So Louisiana actually has a very high rate of preeclampsia when we compare it to other cities in the country because of the population.
Oh, wow. Wow. Yeah. So, Dr. Reed, you are a healthcare professional who still found yourself in crisis. What does that tell you about how easily women's heart health can still slip under the cracks?
I think that shows that knowledge alone isn't just enough, right? So you can read and know all of the things, but if you're not acting upon it or you don't know how to take care of it or how to put that in your everyday life, then you're still at risk. So, and that's what happened with me, right? I had high blood pressure. I went through a very stressful event, didn't, realize the impact it would have on my body. It's like, okay, I'm just taking my medicine, I'm eating right, I'm doing all these things, but I didn't know that chronic stress would also affect my blood pressure. And I had dangerously high blood pressure, which, could have led to a heart attack or a stroke. And I'm a pharmacist, and I know that I'm taking my medicine every single day. I'm checking my blood pressure, I'm seeing the numbers, and it's like, okay, what am I missing? So I think it's very important that we understand, and the health literacy is so important for us to not just have the knowledge, but also know how to apply it, and then know how that affects us in our everyday lives.
Yeah. So tell me about how your lived experience and that personal story shapes the work that you do with your self-care prescription LLC.
So I look at it as, I'm a pharmacist, so I am dispensing medications, I'm talking to patients, but I'm also a patient. So I have both. I'm on both sides. So I'm here to fill the gap, right? So I have that knowledge, I have that clinical information, but I've also sat on the other side of the doctor, right? And I've been dismissed too. So I come in as a pharmacist, they figure I know this and I know that, so I know they don't have to explain all this stuff because I should know it already. Or if I'm answering a question, why they're dispensing a certain medication, it's why it's because I'm trying to question them. So it's being on both sides, but not also realizing I am the patient. I have the right to ask questions. I have, if I don't like the care that I'm being given, I can choose another provider.
Say that part again. That is something that we've been driving home.
You're not stuck with the provider. If you don't like the care that you're receiving, you can choose another provider.
Yeah.
And you can feel free to ask as many questions as you want. And I think I hit a doctor with something one time, and I think he was really shocked because I was asking questions about just my heart in general and tests. And he was like, "Oh, you don't need that." I said, "Well, can you document that in the chart that I don't need that test?" And he was like, "Well, we'll order it."
Oh.
So it's kind of like, but again, I'm here because I want to let women especially know that we have the right to ask questions about our bodies. When something doesn't feel right, we have that gut instinct, and it's okay to question it and seek more answers until you get the answer that you deserve.
Right. And you can get another doctor, get another provider. You can, drill that. Yes. So, Dr. Williams, what are you seeing? Let's just have a moment and chuckle about that because it's the truth. A lot of folks feel like that they can't question, they can't ask, and they also can't decide. I had a friend who was 38 weeks pregnant, decided to fire her OBGYN. And it was a hard decision, but she stuck to it. And she ended up having a better birth experience because she listened to her gut in that moment and didn't just go with, well, it's so late in the game. She's like, no, you're fired. So drive home that. So Dr. Williams, question for you. What are you seeing in women years after pregnancy that connects back to complications but were never told to track? So if there was something small or something large or just something that they never would have known or it's not commonly shared or just,
Absolutely. So I would say the most common thing is high blood pressure. And it's often diagnosed incidentally, meaning that they come for another reason. And we're like, by the way, did you know you have high blood pressure? And they never knew, never thought that they were at increased risk. And I often see when I go back through their medical chart, I'm like, well, your blood pressure has been high on multiple occasions. And they're like, no one has ever told me that. The other thing that I see is coronary disease. Unfortunately, I had a woman who was 46 and had a heart attack. And one of the things that plagued her was that she didn't understand why she was at risk for a heart attack. She was doing everything right, exercise, blood pressure was under good control, not smoking, eating healthy, and she was walking around because she didn't understand why her. And we had a long conversation, and she had preeclampsia 3 times. And no one had ever told her that she was at increased risk for heart disease in the future. And so she said if she would have known, maybe she would have been more aggressive. Maybe she would have, went to the doctor more often, had her cholesterol checked, asked if, we needed to be more aggressive in treating these things to reduce her risk of having a heart attack.
I have a question about what you were about this, right?
Mm-hmm.
If someone has documented and have had high blood pressure multiple times, why would that not be shared with them?
Well, it depends. So sometimes if you're coming into the hospital for, let's say, belly pain, your blood pressure may be elevated in the setting of that. And so they may say, oh, this is the reason for the blood pressure, not bring that information to the patient. And then it kind of gets lost to follow up. Other times, and unfortunately I've seen this as a physician, that they say, oh, it's high, but it's not that high, and it's not treated, okay? And so it can be a variety of things why people are not told why their blood pressure is elevated.
Okay. And so as a patient, what should we know to do?
So Dr. Reed made a very good point about this, but it's not just knowing your data. It's very important to know your data, but it's more important to understand it, okay? And if you do not understand something, it is your right, and I, implore you to ask for it to be explained to you until you understand it, okay? You should know every single medication you're taking, why you're taking it, okay? And you should know all of your numbers. And if you do not know that information, then you are not empowered to advocate for yourself as a patient. And so as a result, you become at the mercy of your doctors. And I love my profession, but everyone is not always treated equally. I'll just be, honest. So there are some biases that comes when it comes to, treating patients. And so it's really important that you know your information.
Yeah. And a question for you, Dr. Reed. How does grief, caregiving, stress, and survival change the way women respond to what their bodies are trying to tell them?
I think when you're having all these things going on, and we do this so much, we ignore signs, we ignore things going on, and we immediately say, "Oh, I'm just stressed out," or "I got a lot going on," or "I'm burnt out," and don't really see that as your body telling you something is wrong, and we ignore that. And I mean, I can be 100% honest and transparent that when I was grieving, that's what I thought. I was like, you know what? It's just I'm tired. I'm, grieving. Another thing is you cannot tell when your blood pressure is high. A lot of people say, oh, I can tell when my numbers are high, because I didn't. Like, I was just thinking that I couldn't sleep. I was crying. I was, going through grieving, all the things. And then when I got my blood pressure checked, it was 180 over 110. And I'm with medication, right?
Wow.
So that was something that I did not. It didn't click to me. So what I'm saying is, I think we just use that as an excuse to delay getting things checked out. Oh, I have a headache. I've had a headache for 3 days because I'm tired. Or I need caffeine. Or just any other thing other than saying, let me stop. Let me make an appointment. And just make sure that everything's okay.
Yeah. Thank you for that. and this is for both of you. This has been such a great conversation. I have so many follow-up questions that I want to ask, and want to honor the time. And thank you all for coming out to be a part of this. And I just like that stat is still sticking with me. So that just means I need to figure out something else to do with it, because this is we need more than this conversation. We need more of this. It's on my heart, so I got to figure it out.
Yeah.
So the closing question for both of you, what is one thing a woman should stop ignoring about her health starting today? And you kind of started that, but if there's one thing or a couple of things about, because we get real good at ignoring stuff.
Yeah, I mean, again, as a pharmacist, a lot of times I see people who like to self-medicate and just assume that I can just take this over the counter for whatever reason. I get a lot of people asking me, oh, what kind of supplement can I take? Because I'm always tired. And they're like, hey, well, maybe you need to get your iron checked or get some labs done. So, of course, don't always just try to fix it on your own. Your body is really telling you something, and it's something that you need to pay attention to. And the only other message that I have besides that is I know, all of us are here. We're here on behalf of moms or as moms, and you have to understand that once you have the child, everyone's focus is on the child.
Yeah.
But we really need to still put ourselves at the top of that to-do list, because if you're not here, then what happens to your child? So I think that's super important.
Yeah. Thank you for that.
Yeah. So just to piggyback off of that, I would say your intuition. Okay. And the reason I say that is because most of us, even from personal experience, we know when something is just not quite right. We may not know what it is, but we know something is not quite right. And that the idea of I'm just going to ignore it and hopefully that feeling will go away, I think we need to stop doing that, because oftentimes it's always better to catch something early than it is to catch something late. Okay. The other thing that I would say is procrastination. We always assume that there will be a tomorrow. I can start eating healthy tomorrow. I can start exercising tomorrow. And the problem is that tomorrow may never come, or when tomorrow comes, you may not be able to do what you plan to do.
Oof.
And I'm guilty of that as well. So this is, but it's just something that I think that we need to be more mindful of. So even with the new baby, I encourage my moms, hey, go out, go for a walk, take your baby with you, because you're working on yourself and you're spending time with your baby. But the idea is not to neglect yourself, because you want to be there, as long as you can and in good health for your child.
Yeah. Thank you so much, Dr. Reed, Dr. Williams. I'm going to figure out how to keep this going, because it's on me. And thank you all for this. And let's clap it up for this great information.